Good afternoon. Welcome to today's Wisconsin Health News virtual panel on the future of dementia care. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thanks to all of you for tuning in today. We have a really great panel with us to talk about this important topic. I am thrilled to introduce Wendy Betley, Senior Program Director for the Alzheimer's Association Wisconsin chapter, Mary Pitsch, co-founder of Livasu, Lynne Sexten, CEO of Agrace, Carrie Molke, Director of the Bureau of Aging and Disability Resources with the Department of Health Services. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. Healthcare leaders from across the state sign up to watch these virtual events, and they would not be possible without the generous support of our sponsors. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Delta Dental of Wisconsin, Amplify Health, Marshfield Clinic, Gainwell, and RSM. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Marshfield Clinic, today's featured sponsor. We are really grateful for their generous support. Here to say a few words is Dr. Kevin Faber, Chief Medical Officer of Sanford Health Marshfield Clinic.
Thanks so much, Tim. Good morning. Thank you to Wisconsin Health News for bringing together such an important group of leaders to focus on the future of dementia care in our region. I'm Kevin Faber, the Chief Medical Officer for Sanford Health Marshfield Clinic, and it's a privilege to be with healthcare leaders, business partners, community advocates, and policymakers who share such a commitment to strengthening healthcare across Wisconsin. Today's conversation comes at a pivotal moment. Across the country and in our communities, our population is aging rapidly. By 2030, nearly 1 in 5 Americans will be over the age of 65. Conditions like dementia, Alzheimer's disease, and stroke are expected to increase significantly in the years ahead. For rural communities, these trends are especially important. Rural providers are caring for aging populations with even more complex needs, while navigating workforce shortages, financial pressures, and reimbursement structures that don't reflect the realities of delivering care in rural settings. At the same time, many rural areas are facing real shortages of neurologists and other specialists, with patients sometimes waiting months for appointments or traveling long distances to receive the care they need. These gaps are exactly what we're trying to close by aligning strong local care with the system resources needed to keep services close to home. This is why Sanford Health is focused on strengthening access to care, quality, and sustainability across rural healthcare. Our commitment is simple. Patients should be able to receive high-quality care wherever they live, regardless of their zip code. That commitment is driving new approaches to how care is delivered. We're using virtual care, team-based models, and shared clinical protocols to extend specialty expertise into rural hospitals and clinics. For example, virtual specialty consults, remote monitoring, and rapid imaging review help patients start the right care plan sooner while remaining in their community whenever it is safe to do so. Sometimes, every minute matters in healthcare, and integrating virtual support with local care teams can improve the speed of treatment while reducing unnecessary transfers. At Sanford, we're also preparing the next generation of clinicians with training that combines both in-person care and virtual skills so that they're well equipped to serve our rural patients across specialties. We've seen that when rural healthcare systems have the right partnerships and scale, they can recruit and retain clinicians easier, expand access to specialty care, and stabilize services that communities rely on. The combination of Sanford Health and Marshfield Clinic strengthens Wisconsin in many practical ways, including shared recruitment, integrated call coverage, coordinated transfers, and virtual specialty support that back up local clinicians. Working together allows us to bring more specialty outreach to rural Wisconsin, including for dementia, support our local hospitals during staffing shortages, and invest in tools and technology that smaller facilities might not otherwise be able to sustain on their own. Ultimately, strong healthcare services are essential for strong communities. Not surprisingly, healthcare is often one of the largest employers in rural regions. and access to reliable primary, specialty, and emergency care plays a meaningful role in whether families and businesses choose to stay and invest locally. That's why conversations like today's matter so much. Addressing dementia and the broader challenges facing rural healthcare will undoubtedly require collaboration across healthcare systems, policymakers, researchers, and community leaders. So we're very grateful to Wisconsin Health News for convening this discussion, and we appreciate the work that each of you do to strengthen the health and future of Wisconsin's rural communities. Thank you.
Well, thank you, Dr. Faber. Some great words to get us started. And thanks again to Sanford Health, Marshfield Clinic for the generous support and helping make today's important discussion possible. And thanks again to our panelists for sharing their expert and valuable time with us today. More than 120,000 Wisconsinites aged 65 and older have Alzheimer's disease or related dementia, and that number is expected to nearly double by 2040. Dementia affects more than just the person living with it. It impacts family members and friends who serve as caregivers, often unpaid. And this impact is only going to increase as the baby boomer generation continues to age, placing even more stress on an already strained long-term care system. So we have assembled a panel of experts today to talk about how this is impacting Wisconsin families and the state's healthcare system. We also want to highlight some of the innovative solutions that are sprouting up to ease the burden on caregivers and improve the quality of life for the growing number of state residents who suffer from dementia. I have a long list of questions to get us going. We had some great questions as well from audience members through the registration process, and we did our best to incorporate those into the questions that we'll ask the panelists. So Carrie, let's start with you. What is the state of dementia care in Wisconsin today?
Yeah, thanks. And thanks so much for having me. It's an honor to be with this panel as well. So you hit on some of the statistics, and I think I'll just hone in on a couple that you didn't say. And I know for me, sometimes it's the quick stats that are really helpful. So for example, for me, thinking about right now, 1 in 9 older adults has a dementia, and by 2040, it'll be 1 in 7. So just looking at from that perspective, it is a growing disease, of course, and a growing experience for both caregivers and people obviously living with dementia. Those 85 and older are 6.5 times more likely to have dementia than someone 65 to 74. Dementia prevalence rates, breaking it up by age groups to give you a little more information, is that people between the ages of 65 and 74, it's only about 5.3% of our population of folks have dementia. Ages 75 to 84, it's 13.8%. And ages 85 and older, it goes all the way up to just about 35%. So you can see that age is actually the number one driver of people with dementia. It's the number one reason that risk factor. That's the word I was looking. The words I was looking for. The number one risk factor for dementia is an increase in age.
Thank you, Carrie. Wendy, why is the prevalence of dementia growing? Is it because our state is getting older? I mean, why are these numbers really kind of accelerating here in Wisconsin and around the country?
Carrie hit it right on the nose. It's age. Unfortunately, we all get older. And so it's one thing that's been really in the front of many discussions. I think also the way we are diagnosing is becoming more effective over time. Early detection is, we've really gotten better in the state of Wisconsin on early detection as well. We have a long ways to go, but people are being diagnosed earlier. It's not as much of it's still a stigma, but there's conversations happening. And I think that's also what's bringing people to the doctor's office to have those conversations. So, and I think I want to add on to Carrie's, comments before, with family caregivers, there are over 205,000 family caregivers here in Wisconsin who are providing 297 million hours of unpaid care. That's huge. And so, and that's valued at $5.5 billion. So the impact in Wisconsin, it's huge.
Thank you. Carrie, can you just expound on that, the impact that this this kind of growing prevalence of dementia, is having on the state's resources and the state's healthcare system.
Yeah, absolutely. And what I want to say on the front end, actually, particularly as we know that we are all aging, which is a wonderful thing. Actually, it's quite a privilege for us to have long lives. And I think a lot of times when we have these discussions, we talk about it like it's a burden, and also like it's a strain on our systems. But the reality is that this is something that is a part of the human experience and part of the human condition. And I just really encourage us all to care about this issue of dementia. And because frankly, people are only vulnerable if we don't have services, systems, and environments in place that are supportive and are supportive of the needs of people as they age. So it should be more about, taking the point of view as something that we all own, we all should care about, and that we all can play a role. Many people in the systems need to make appropriate changes so that we all can live better lives as we age and experience dementia. Now, that said, you bet it has an impact because we are not set up yet to appropriately care for people with dementia and support. And so we have been taking a systems-wide look in the state, starting we've always cared about dementia, I will say that, but we really picked up steam, I would say, in 2013 it was the year that we first developed our state's dementia plan, which we have been renewing every 5 years. And it has been an incredibly collaborative approach that has been built on a lot of feedback from local communities, people that experience the disease, as well as providers across all systems, from healthcare to facility-based care to community-based care to our crisis system and our APS system. And did I say healthcare? I might have missed that really important one. But basically, right, all of the systems of care. So the impacts are profound when it comes to having insufficient workforce across all of those systems of care. The increase in costs associated with those things are a reality. But as I mentioned before, that is why conversations like this is so important, that we all find our place in it and find ways to change the system for all of us as we age.
Thank you. Thank you, Carrie. Wendy, and then we will bring in our other great panelists. But Wendy, just to add to that, I mean, what are some of the barriers to care and access that we're facing, that have been identified in the plan, and that we're kind of continue to face right now in the state?
Guys need more workforce, which is huge. I think, we're seeing that as the biggest impact in Wisconsin at this point. We really think, the need for dementia-specific training, I think, is really essential for everybody. There's not any explicitly required, regulations around standards of care, but the association has really put some really great practice recommendations for training to cover numerous types of topics, such as understanding dementia, effective communication, person-centered care, and remaining independent as well is one of the big items that we continue to talk about. So yeah, I think that has some. I also think being rural and not having that easy accessibility, transportation, I think that's a common issue across the state, and being able to have that access. But I also think the other part is just educating the community on what is available in resources for people who are living with a form of dementia. I think that's one thing I've seen a lot of, is that people just don't know that there's a lot of great support available. I mean, through our local county, through the Alzheimer's Association, through a lot of the state initiatives, and other great community partners in Wisconsin is very wealthy on that, of all those resources. So I don't think people know about it. So I think that becomes a barrier in itself.
Thank you. And Wendy, just to stay with you for another follow-up, what about the cost of all of this to families? I mean, not even including the kind of tremendous unpaid caregiver workforce. What about those families who maybe aren't able to provide a caregiver? What is just kind of the cost of this on a lot of families, and those that maybe have to go to assisted living that can't be cheap, that isn't cheap. What about the cost of this to families right now?
Yeah, it's a very expensive disease. And I don't even know if even if you have millions of dollars, it's still gonna impact you both emotionally and financially. It's a big stressor to a lot of us. But I think, one thing that was really exciting that just happened is, well, Wisconsin's got some great grant programs, assistance programs that other states don't have. Many times when I'm working with families, they're like, "Oh, we have this grant. I didn't know that this was available," that help offset some of the steep costs to the caregiving. And one of them recently, it was the Alzheimer's Family Caregiver Support Program. The bill was just passed last year. We expanded the program by removing the financial eligibility requirement, which actually removing that allowed more families to receive more caregiver support and kind of remove that barrier that was there. So Wisconsin, again, I love working for Wisconsin, as you can tell, just because of the resources that are available for families. And that's the other thing is, you work with your local aging disability resource centers. They can help guide you if you're financially struggling. We've got a lot of those great resources right in our back door through the dementia care specialists.
Thank you.
Very unique resources.
Yep.
Thank you. Mary, what do you think are some of the main barriers to care and access for dementia care right now in the state?
Yeah, I would agree. The stress that families are dealing with is definitely a barrier, and just the denial, I think, is a barrier. It's hard to want to come forward and admit that we have an issue, and we talk a lot to families about how powerful denial really can be, and just not understanding that it isn't a normal part of aging. I think is also a barrier because people just, it's a normal part of aging. Of course, my mom's going to get confused. So I think just learning more about that will help some of those barriers as we become better at understanding it.
Thank you. Mary, what do you think why is there such an interest, by you and others in changing the way that some people receive dementia care? There sounds like, there's a lot of great stuff going on in Wisconsin. But what are some of the challenges to the current dementia care system right now?
Well, I think there's a lot of challenges. For us, it really came to be about just looking at a way that we can live better with dementia. Research is great. Those are all important things, but we're not getting very far ahead in the research and in the diagnosis of or the treatment of dementia. And we need to do something in our state, I think, to help support those that are living with dementia and their family members. And that's by being able to provide better environments for the people with dementia and for their families. As we were just talking about, it isn't just a disease that affects one person, it affects the entire family. And we need to do a better job, I think, of really looking at environments that help support the person with dementia and help support the family. So that's really one of the reasons that Livasu started.
Thank you. And Mary, I want to get into a little later in the program into more of the specifics about Livasu, and Lynne, I want to bring you in and get into more of the specifics about Agrace's planned dementia village. But Lynne, how would you answer that question? What do you think are some of the main challenges with the current system for dementia care?
We're an organization that for almost 50 years, we've been invited into people's homes, wherever they call home, with our hospice program and then other programs that we've developed over the years around palliative care and non-medical home care. And in the last 10 years, our adult day center. And what we've been seeing firsthand is just the statistics that both Carrie and Wendy talked about. We see the impact of those statistics in real time. Just the incredible burden placed not only on the person that's living with dementia, but the loved ones that surround them and are doing their darndest to support mom or dad or spouse. And what really drove us was seeing how the structures that not just our state, but many states have in place around memory care aren't always producing the kind of quality of life and good outcomes that we all would want for ourselves, for our own parents, our own spouse. And so for us, the true north was similar to what Mary said. How do we do it differently so we still maintain the safety and maintain the kinds of things that someone that's aging with dementia needs, but they're in an environment where they thrive and their quality of life is high and their family and friends feel great about visiting them.
Thank you. Wendy, you mentioned a lot of the great research that is happening in Wisconsin, some of the specific grants that the state has received. As we're still learning a lot about dementia and how to care for people with dementia. What do you think about the current kind of research dynamics in terms of funding with uncertainty at the federal level? I mean, is there a concern that could impact progress in this? What is kind of your thoughts on the future of research funding for dementia?
Yeah, I mean, I think we all kind of took a step back, right, when we started hearing these concerns. But, that's, despite the earlier proposals to reduce medical research at the federal level for Alzheimer's, we've actually have made some progress that doesn't seem to be stalling. Congress just recently secured a $100 million increase for Alzheimer's and dementia research at NIH, which I don't think we were expecting, but this is a good track. This is a good place to be. They're going to continue to move forward and provide that. So even though we were all kind of stunned and kind of worried, it still continues to move forward. And the Alzheimer's Association is supporting that. We're one of the largest nonprofit funders for research across the world, and we really want to make sure that this keeps moving forward. So yeah, it's been good things despite the worry that we first had when we had some transition.
Thank you. Are you seeing the same thing, Carrie? I mean, what are your thoughts on the future of research funding for dementia care?
Yeah, I mean, I still feel like when you compare it to other diseases for which we're doing research on, we still have a way to go. So it is good to be able to take a deep breath after really experiencing the fear last year of, potential cuts to this. It is good to see that that's been sustained, but we still have a long way to go. So really encourage policymakers and others to influence that as much as possible. Because at the end of the day, obviously, if we can find treatments that work, if we can find a cure essentially to this disease, that obviously is the North Star all across the board. So we really all, of course, have an interest in seeing that happen. It won't happen without research. So it's really important.
Thank you. So Wisconsin, as was mentioned, Wisconsin will soon be home to 2 dementia villages, which will be among 2 of the only dementia villages in the country. These projects have some differences. Lynne, can you just kind of start and tell us more about what you're planning at Agrace? You've kind of gotten into this a little bit already, but how did this come to be? Why are you moving forward with this?
Yeah, so we knew that if Agrace wanted to step into the fray and try to find a better solution that produced higher quality of life, that we didn't want to do what I could find down the street in a memory care facility. And so we've spent quite a bit of time in the Netherlands, and the folks at Hogwick have spent quite a bit of time here with us. And really what we're out to develop is something that looks and feels like a neighborhood that you would find in rural Wisconsin. It'll feel like a main street, downtown, rural Wisconsin, small homes. People, no more than 8 people are living in a home. They have their meals together. They participate in preparing the meals. They participate in keeping the house tidy. One of the really unique things that we learned from Hogwick is how when folks decide to come and live in the village, that they are assessed based on kind of the norms and values and lifestyle that they had prior to coming to the village. And so you purposefully group folks in a home where they have similar backgrounds, similar preferences. They might like the same TV shows or the same food. And they really get to develop their own little new family. It'll be a licensed healthcare facility, so we'll abide by all of the rules and regulations of our state. And I really have to hand it off to the Department of Health Services. We don't fit cleanly into any of the categories for licensing right now. And the state has just been phenomenal working with us to help us navigate a path, so that when families decide to bring their loved one to live at the dementia village, they can feel really good about knowing that the state is kind of giving us their stamp of approval. It'll
And how will it
be
just how will that work? I don't know if Carrie, you want to answer that, or Lynn, you'd be best suited to answer that. But how will it be kind of like an assisted living facility, or how will this work with the license?
yeah. So we'll be licensed as a CBRF,
Okay.
assisted living memory care, but in order for us to achieve the concept and really remain true to the Hogwick model, there's just certain things that don't comport with the regulations in the state of Wisconsin around what it means to be a licensed CBRF. And so we've been working really closely with the state to get certain waivers and whatnot so that we can really stay true to the model, and not, which so many of us throughout the United States, not just Wisconsin, we're so medicalized when it becomes to custodial memory care. And what Hogwick has done, and they have remarkable results of fewer medications, higher quality of life, less behavior issues. We really want to stick with a social model and not allow ourselves to start to migrate to the medical model, and really return to the residents that live in our facility a sense of autonomy. They can make their own decisions throughout the day, what they want to do or don't want to do. Spontaneity, develop their own network of friends. We'll have a 50-person adult day center that'll also be part of our village. These folks won't live there, but they'll come and go each day from wherever they call home. But it will make for a very bright, vibrant, large village.
And what's the timeline? When you're broken ground? When do you expect?
Yeah. So we break ground in April. And we expect to have adult day club members and residents start occupying the village in September of 27.
Wow.
Yeah.
What kind of numbers are you thinking? What's the goal?
So there will be 8 houses, and 8 people can live in a house. So we'll be able to have 64 people live there, and then 40 to 50 day club members. We'll have a grocery store, coffee shop, a large 100-person theater. We'll have a men's moose lodge. We'll have club rooms, art rooms, fitness center. People will have to engage with the outdoors. You can't just be inside a building all day, every day, like a hotel. You'll have to leave your home, go across the street to go to the grocery store to get a cup of coffee, to go to the pub and grill, watch the game, go to the spa. So it will have all of these amenities that really will feel like I don't have dementia right now, at least, and what I leave my home and go experience when I want to avail myself of the services in my community.
And who provides the care? Will they be living there too, or how will that work?
So it will be Agrace providing the care. And one of the things I'm really proud about what we're doing is part of this project is to create workforce housing. And we're going to partner with the local universities, and students pursuing healthcare degrees will get free room and board in a studio apartment in exchange for working a certain number of shifts each month for us. And we feel like that's like, one, it exposes a whole new crop of students to the joys of working with this population. And then 2, it really goes a long way to helping us mitigate all of the pressures all of healthcare is under around workforce issues.
This sounds great. It also sounds expensive. Where does the funding come for this? How does a patient get into this?
Yeah. So to just give you a sense of the interest, so when we started announcing, sharing with the community our plans, you could go to our website, find out more, and sign up if you would be interested in getting on our wait list when we start one. We haven't started one yet. And so we're close to 300 people on the list right now, wanting to be notified when our wait list starts. So a huge amount of interest just because it's just different. It's not the traditional memory care. Anytime you go into assisted living memory care, the room and board is self-pay. Medical care is typically covered by Medicaid, Medicare, or whatever their private insurance might be. The same will be true for our dementia village, but it won't be at a premium. We are pinging the cost to be right at par with other assisted living memory care in our community.
Okay, so you won't be taking insurance. So if someone's on, Medicaid, can they come, or how would that work?
Yeah, so we also have an endowment. We have incredibly generous donors. So we will have a sliding fee scale where if someone isn't able to cover the full room and board, our endowment will have a sliding fee scale. So insurance will definitely be billed to the extent someone has medical needs, which will be provided by our medical staff. So we have our own team of physicians and nurse practitioners, nurses and whatnot. So most of a resident's medical care will be provided by Agrace, but when they need more specialized care and whatnot, obviously that'll be referred out.
And so why do you think there aren't, any other or many other villages in Wisconsin, in the country like this yet? I mean, what's holding others back? And do you think there's ability to have this be replicated?
I don't have I don't have an educated or a well-researched response. I have my gut. And so across the country, not all, but many assisted living memory care organizations are owned by for-profit companies, whether they're publicly traded or they're private equity. And those organizations have certain goals that kind of are at the top of their totem pole of goals. And so there's a model out there of how to make memory care as profitable as possible. And I would venture to guess that staffing a grocery store, staffing a spa, staffing a pub and grill and a coffee shop, and building little tiny homes rather than one big large facility, the model is different. And my guess is that where others have not been successful in establishing a Hogwick, very true to Hogwick model in our country, because others have tried. The folks from Hogwick have told us, others have come to us and we've worked with them over a long period of time, but the model ends up changing so much that Hogwick isn't really interested in having their name associated with it anymore. That's just the Lynne Sexten guess of the staffing model, and the costs associated with what we're building might not be as great a fit with some of the larger for-profit chains in our country.
Thank you. So Mary, you've been consulting with Hogwick as well. Can you talk about what you're planning and how this project came to be?
Absolutely. So first of all, I think it's just amazing for Wisconsin that we're going to have two Hogwick inspired and supported communities. I mean, how awesome is that for Wisconsin to have options here and really make Wisconsin be a leader in dementia care? That should be exciting for all Wisconsinites. So we started a bit differently. We started really as a grassroots effort that was really focused on dementia crisis situations and how we responded to those in our community. And while that we've done amazing things through our task force work, but several of us said, great work, but it was still a Band-Aid approach to a crisis situation. And we said we wanted to look at how do we prevent even more crisis situations, and that's by looking at the environment in which the person with dementia lives. So we created the nonprofit Dementia Innovations to be able to focus on the living environment, and that's where Livasu came from. So Livasu comes from bringing together the words living as usual. And we too had spent time in Netherlands with their founders. We've done training with them. And, we vary in some ways from Agrace, which is great because two models in the state is great. So we are a bit different in the fact that we really are all about living as usual and what the name comes from, living as usual. And it's a filter question we're using in every decision we're making when we come to making decisions at Livasu. One of the things that we talk a lot about is that we're writing the playbook, right? No, this hasn't been done in the United States really before. So we're writing that playbook so others can have an easier time going forward and doing something similar. So we are 124 individually owned homes. And what that means is that it's really, again, living as usual, meaning spouses can continue to live together. That's not something that most traditional models of care really offer a great option for spouses to be able to meet both of their needs. So living as usual means living with your spouse if that's what you so choose to do. Now, individuals can still continue to live at Livasu and receive all care and support by on-site staff. I always kind of joke around that the last time I lived with a group of strangers was in college. So living with your spouse is something that our focus group said was really important that they wanted. And having a family partnership in care. It isn't just about Livasu, it is a family partnership in care, which again is something that our focus group said that they really wanted. They wanted to be part of the care, not seen as an outsider.
What's your timeline? When is this going to be open? When will patients start living there?
Yeah, so homeowners will start living at Livasu come July already. So just 4 months away. Our first 20 homeowners will be able to move in. And then in September, we'll have the next 20 homeowners be able to move in. And then the other houses will be phased over a period of time. We also have a gym, a coffee shop, ice cream, grocery shop. Again, a lot of those community spaces so that there's opportunities for hobbies, interests, and being able to socialize, meet the needs of the person with dementia. The entire village is being really designed thoughtfully for the person with dementia to meet their needs.
And how will care be provided? Will providers come to individuals' homes and provide the care? Will there be a clinic on site? How will that work?
So all care and support is provided by on-site staff. That is hired by Livasu, employed by Livasu, I should say, and then offered in blocks of time. We're really kind of a unique model of care. We are really more of a home care model because again, it's homes. So there'll be a shared service fee, and that might be all people need to be able to support and live there. But then if they need more care, they can buy blocks of time to meet their individual needs, which keeps it really affordable.
And will you take insurance? Can someone with Medicaid come and live there and get care, or how will that work?
Sure. Long-term care insurance, we would fit into more of the home care part of long-term care insurance because they own their own home. We don't meet the state definition of a licensed care facility, so it would fall into a home care model under a long-term care insurance policy. And then we do expect over some phases then to be able to accept family care as well.
Okay. One of your, in an interview you did with our newsletter, Wisconsin Health News, one of your co-founders mentioned that there are some naysayers about this project, specifically from the regulatory world. As you mentioned, it won't be licensed like a traditional medical facility. Can you talk about this? I mean, what will will it be regulated in any way, or how will that work?
Well, I don't know that there's been naysayers. We've had conversations with the state, and we don't meet the definition. So we're not being an unlicensed facility. We don't meet the definition because facilities are people living together in a facility, in a building. And we have homeowners that own their own home. So we don't meet a definition of any state licensed care facility. We're excited about that. Home care happens all over our state, right? And we're able to, again, make sure that we're not meeting a low bar of regulation, but being able to provide a standard of practice that meets the person's needs. Home care in the state of Wisconsin, non-medical home care, is not licensed. but you can still provide the amount of support that's necessary and appropriate to be able to meet the needs of a person with dementia.
Is there a concern that this could be a way for less reputable companies than yourselves to kind of come in and maybe skirt some of the regulations of assisted living?
Well, again, we're not trying to skirt anything. We don't meet the definition. So we didn't create the definitions of the state. We've had conversations with the state. They are supportive of the fact that we've gone through the definitions and don't meet those definitions. I'm actually excited to be able to say that we're providing great outcomes through an environment that's designed specifically to meet their needs, rather than only looking at trying to cover a regulation, and be able to provide great outcomes in doing so. That to me is an exciting way to be able to meet great care and standard of practice.
And do you think this is a model that you foresee being replicated by yourselves? I know you're just starting with this first project, but do you see you replicating this in other parts of the state, or other groups planning other villages in other states or other parts of the state?
Yeah, absolutely. As I said, we're writing the playbook, and every decision we're making is a new decision. So to help somebody be able to do that and do it well, learn from our mistakes, learn from the things that knowledge we've gained, I think will be really helpful for others to be able to do this. Because the bottom line is we all want to be able to live in a place that provides a better way of living for those with dementia. And I think Livasu will really provide a great model for doing that.
Thank you. Wendy, as was mentioned, I mean, it's pretty amazing that Wisconsin will soon be home to not one, but two dementia villages. What are some other innovative solutions that are happening or are being talked about to address dementia care in Wisconsin?
Well, that's a great question. I just wasn't prepared to answer, but I think.
Well, what about technology? What are some of the ways
Yeah.
maybe technology is being used to overcome some of these barriers to access?
Yeah, no, I think what both Mary and Lynne have hit on is people really want that person-centered care. We want to continue living our lives the way we've always wanted to live, and a disease like Alzheimer's or other type of dementia shouldn't take that right away. We have the right to live the way we want to, and so I do think, some of the innovations that have been happening, I mean, throughout the state of just trying to people to reduce, social isolation, our memory cafes that are out there. We have dementia-friendly initiatives happening throughout the state. So we really, as a state, are really trying to provide education and support to businesses so they know how to interact when someone comes in with dementia, so they don't feel, that they don't fit in anymore, because that's the one thing about dementia, right? Is many of the people that I've worked with is once they're diagnosed, they're just like, what do I have to live for? What am I going to do? Where's my sense of purpose? And we need to really find out how we can continue to support and have them feel successful in living, because all of us wants to feel successful, right? There's never do we want to feel that we don't have anything to live for. We want to be part of the world. We want, we are who we are. And so the memory cafes, the dementia friendly initiatives that are happening throughout the state. But then we have this wonderful technology. Not everyone agrees with AI. I'm going to tell you that we all have our little learning curves on that. What works, what doesn't work, what do you believe, what don't you believe? But I have seen some amazing things to help support families living in their home and continue to live in their home. And there's ways they can have music therapy. I'm not going to try to say her name too loud, Alexa, because she will answer me in my house. But there can be reminders on medications. There's great technology around wandering and falls. They can, detect if someone falls in their home. Boy, I wish we would have had that a few years ago with my family, who, we experienced that too, where she's on the floor for an hour or two, even though, she just didn't want to bother us. Not that she couldn't call us. She didn't want to bother us, but there's all these great additives that can be brought into the home to really reduce some of that caregiver burden. Those medication reminders, as I mentioned, just to say, good morning. It's Tuesday at 11 o'clock. It's time to get ready for lunch, or, your daughter Wendy, has your lunch in the microwave, and you just have to, there's so many prompts that can be done. Not that we don't want to take away that social interaction, because that social interaction is huge. It's probably one of the best medicines for all of us. I think we learned that from COVID when we had the isolation. So, but yeah, there's a lot of great innovation happening. And I think technology, you like it or love it or hate it or whatever, it really is helping us live better, and in not only helping us take care of our loved ones, but also reducing our stress level. There's a stat out there that says 70% of those caregivers, spousal caregivers who are 70 years or older of somebody with Alzheimer's disease pass away before their loved one does. That is huge. And I and everyone else on this panel would love to have no more caregivers, because we would love this disease to be gone. And so whatever way we can do to support people who are currently living with it and eventually find a cure, I think that's what we're aiming for.
Thank you. Carrie, what impact do you think that technology can have on improving access and addressing workforce shortages? I mean, do you see a role for AI in improving dementia care?
So I'm actually really big fan, and I will admit that I'm not tech savvy, but even just some of the research that I've done and some of the stories and some of the experience I've had, I just think there's huge potential. And you named workforce. It is one amongst several strategies, but a really key category of goals, that a goal category, sorry, that we really need to hone in on and focus on. I think for me, though, the biggest thing, particularly for this population, is I would also like to see some research done on the degree to which it works for this population. When is it okay to use AI to replace human care? I think we have to be really deliberate about that, and I think research could really help us have more information about that. So, and then I have a number of innovations that I can share too for our state, if you want to circle back to that later.
Yeah, please do. Let's how about right now?
Okay, sure. I actually sketched like Wendy. So anyway, I'll try not to take up too much time, but I just starting with the fact that I am just excited to hear from both Mary and Lynne about this new innovation that they're bringing. And this is just, Wisconsin really is an innovator. So a couple things that I'll name. The first one is dementia care specialists that exists in aging and disability resource centers. We now have one in every single ADRC across the state, as well as every tribe. These are folks that their scope of work is humongous, but they, because most people, even though we have some of these innovative housing models, most people do still live in their homes. And so the work that the DCS do to help support caregivers, help support people living with dementia, they are often catalysts to dementia-friendly communities and building memory care. Cafes, memory cafes, as Wendy was talking about, are really awesome. So just really excited to have that resource here, unique in the country. Other states are trying to replicate that. So that's my 1 minute, synopsis of the dementia care specialist. A couple other things. One is Wendy also mentioned social isolation and loneliness. And when we had access to AARP funding the last couple years, we made available to local communities grants, mini grants, essentially, not very much money, but little mini grants to really try and tackle social isolation and loneliness. And we had 37 projects across the state. And while they weren't, not all of them were targeting people with memory loss, people with memory loss and their caregivers really benefited from what grew out of these pilots, these little mini grants. And I want to just talk about two of them really quick, because it feels like it connects with something Lynne talked about earlier too. Men's Shed is a model that also was built in some European country. Forgive me for not remembering which one. But it is because men are more likely actually to experience loneliness as a part of living alone. And so it is a place, right, where people can come and be together with other men who are experiencing all sorts of things. And just some of the stories about people who are caregivers, men who are caregivers of people with dementia, and also people with dementia are welcome there too. So kind of like a memory cafe, but also just a unique model for addressing social isolation for a population with a high incidence of it. The second one is a repair cafe, which I don't know if you've heard of these, but it's so cool. And it's so simple. You just need, a group to start it off. But essentially what these are, as the term says, it's a place where people can go and have stuff repaired. And the people who are repairing them are community members, including, in some cases, people with dementia, so that they can continue to use skills that they might have had, when they were younger, a career that they had in their lifetime. And then the benefit, too, of people leave with repaired stuff, from lamps to, jeans. Like they're seamstresses, sewing people's torn jeans and that sort of thing. So again, the benefit of that community, and then you leave with a product to that, you know what I mean, rather than having to spend money on something. So it's got all those benefits. Two more really quick. One is the DPI. So we've been working with the Department of Public Instruction, because if we can start educating about brain health early in our lives, you can imagine the impact that it can have throughout our lives, number one. Number two, we know that a lot of young people are also serving as caregivers, informal. Often they don't even know that they're playing that role. And they're confused when they're working with their grandfather who isn't making any sense, or why, and so we've created a program with DPH. It's a curriculum that can be used in health classes. It can be used in science. It's a fit for, different spaces. And in addition to doing those things about educating about brain health and caregiving, it also teaches advocacy within the medical space, so that these kids are learning how to advocate if they are taking, grandfather or grandmother to, a doctor's appointment or whatever, just to know how to do that. And they have to do projects. So they actually do, a project associated with that. So I think that's cool. And that's being used, it's being expanded. It does require teachers to take on this as one of their, pieces of their curriculum. So we still have more to do, but I just think the impact there could be so big. And then the last one is so much stuff in our BOLD grant. So BOLD is, as Wendy was talking about, grants. We have, I think, 5 different grants that have come into us. That might be an exaggeration, but it's a number of them that have come into us as a state that have just been so helpful in being able to make a big impact. So BOLD stands for Building Our Largest Dementia Infrastructure Grant, just to make it so long, but BOLD. So it is really helping us build out more infrastructure. And we had a 5-year grant that ended and we got extended. And so we are doing so many things with this. A lot of it is outreach, really looking at specific populations that are more at risk, engaged. There's so many partners engaged in helping to support, education, unique education that's built for particular communities, like tribal communities, the Latinx, Hispanic community, deaf and hard of hearing community. We now have ASL interpreted information available. And it's funny, but nowhere else in the country has that, which is shocking. But now we have that, and it's something that we can make available for this unique population. And we know that we're learning that hearing loss might have more of an influence on acquiring dementia. So it really is important that we're making things accessible and focusing on, people who are hard of hearing and deaf, which is often a lifelong experience. So learning more there. We do there's a number of caregiver efforts included in this too, where we're really building out our respite network for supporting caregivers, and I could go on and on. So I will stop because I know I just said way too much, but I hope that was helpful just to share.
It was. Thank you. Thank you, Carrie. Yes, thank you. It's a great list. There's a lot of great stuff happening in Wisconsin. Wendy, what despite all the great stuff that...
Tim, could I
Yeah.
I just piggyback on something
Yeah.
Carrie was just saying,
Yeah.
because there's something underlying the comments that all four of your panelists are saying, and that is all too often when someone has a dementia diagnosis and their disease begins to progress, their world gets smaller and smaller and smaller and smaller. And that leads to frustration, that leads to a feeling like I'm lesser than, I can't still be the person I want to be, even though I have dementia. And the tools that each of us are talking about are designed to help those individuals not have their world shrink so much. So the groups that Carrie was talking about, the technology that Wendy was talking about, the living environments that Mary and I are talking about, and probably each of us are employing some of the very same tools Wendy and Carrie were just mentioning, but it's all designed to help those living with dementia not have their worlds just get so small.
Thank you. So we're quickly, unfortunately, running out of time. This has been a great conversation. There's a lot of great stuff happening here in Wisconsin. To sum things up, and we'll have each panelist answer this last question. If you had to pick one specific significant step that is being taken right now, or that could be taken to improve dementia care here in Wisconsin, what would it be? And Wendy, let's start with you.
Sure. I'm going to kind of take off of what Carrie had mentioned about brain health and the younger generation. I think one thing we really have to start focusing on is building those healthy habits and really instilling this into our younger people across the state of Wisconsin, across the country, really. We have great medications. We have actually 2 treatments now that really help in the early stages of disease to address the underlying symptoms. And so, but people aren't aware of that. So I think one thing we really need to do as state is continue to work on and raise awareness about the warning signs of Alzheimer's and other types of dementia, but then take that step back and start instilling healthy habits and really having people understand how that really can impact your brain health when you get older. It's amazing, what's being done. The Alzheimer's Association leads the U.S. Pointer study, and it has shown that when you put healthy habits in place, it can actually have your I don't know how to say it right, but your brain appear 2 years younger than what it was by starting these steps. So I think that's something that we could really impact if we really start taking our health more seriously, especially our brain health.
Thank you. Lynne, how would you answer that? What is one significant step that you think could be taken to help improve dementia care in Wisconsin?
Ultimately, right now, we're in a situation where we have so much need, and we don't have the caregivers, we don't have the workforce, we don't have the infrastructure to meet the need. And I just feel like funding is, yes, funding for research, absolutely, but funding for the care we need now, today, especially those folks that are living in poverty. They don't know the resources that are available. And then even when they start to know, they think, well, I could never afford that. And so their mental health begins to get impacted as they desperately try to care for their loved one. So just funding to meet the care needs today.
Thank you. Carrie, how would you answer that question?
Oh, it's so hard, I will say. So I think as I think about this, I agree with both of the comments. And Lynne, I have a long list of spaces where funding could be really useful, but I want to offer actually something that doesn't necessarily require funding that I think is so essential for setting us up for success in the future. And it's really about creating. I'm reflecting on things that we've done in the past. Like the legislature, the Speaker of the House, set up a committee, a task force on dementia a couple of years ago, five or so years ago. It led to this amazing, long-lasting process of 10 bills and ongoing, right? That led, it continues to build infrastructure across systems, across all the systems. And then this Governor Evers, stood up a task force on caregiving. So I'm not sure if I'm like trying to encourage another task force, but it's more so some type of process where our legislators, as key policymakers, and our executive branch are really having a big conversation and getting input, really focusing on aging issues, including dementia. Because my experience has been when that has happened, we've gotten some amazing stuff, to transpire. It helps lead the conversation for the state. So I just want to, continue to encourage collective impact in the state. As many partners as possible coming to the table saying, I care about this and I have this to offer. So I guess I'll just leave it there.
Great. Thank you, Carrie. Mary, we'll give you the last word. What is one significant step that you think could be taken to improve dementia care?
I think honestly, it's just starting to have conversations that some of us might be thinking are kind of perceiving them to be uncomfortable. And if we really want to look as a state of changing the culture care of dementia care and support and really looking at it from one that addresses dignity of risk, so that people with dementia are not really defined only by their dementia, but are able to live quality lives. And sometimes that culture change requires some tough conversations. So I think that opening the door to conversations like this one are really important.
Well, thank you. Thank you, Mary. Thank you all. This has been really great. Really appreciate you taking some of your valuable time today to share your expertise. Thanks to our generous sponsors for making this possible. We'll be back in person for our next event on April 8th in Madison. We're hosting the major Democratic candidates for governor to talk about their health priorities for the state. So hope to see you all there. Thank you all. Have a great rest of the day.
Thank you.